So welcome to the fourth and final session in our Shift webinar series today. So we are going to be looking at STIs today, but I'll go through my usual introductions to start with to give people time to get in, and I'll talk to you about the Shift resource booklet as well and how you can get your hands on that and sending it out. So as usual, I'm sure most of you know me by now. My name is Mura and I'm the Health Promotion Officer, Youth Health Promotion Officer with the Sexual Health Centre. So I have been delivering the Shift webinar series. I come out and do workshops with young people in all the different organisations, and I'm behind the Sexual Health Hub stands and the Instagram page. So I know I've said it to you before, but I'll just put it up again. The Instagram page is a dedicated youth page, so it's all sexual health information, youth orientated. There is an agony aunt segment, so we have a shift expert, as we've called her, who will answer any questions you have anonymously and give you the accurate, factual information and signpost you to services or where you can go to get help if you need it. So give it a like, give it a follow if you can, or if you ever just need to ask a question, if you're not following it, you can still pop on and ask that. So you can DM a question, or I put up little boxes so you can actually answer into the Q&A boxes as well if you want. So our final webinar today, we are going to be looking at STIs. So we're going to look at what are STIs, how are they transmitted, some are treated and managed rather than cured, and we'll look at some of the STI rates in Ireland among young people, so kind of 15 to 23, just to give you an idea of what's actually out there and what people are experiencing. And then we'll talk about HIV. So we'll look at how HIV is transmitted. We'll look at the different medications available around PEP and PrEP, so prevention of HIV. We'll also then look at STI testing. So what actually happens when you go to get an STI screening? What can you expect? And I'll go through some of the frequently asked questions, the most common things that people are kind of worried about when they think about going to get it, or they're not sure how it will be. So that is our plan for today. Before we get started, I'm going to do my usual. Would everybody pop into the chat box, if they don't mind, how many people are watching, if there's more than one on any account, just so we can keep track of accurate numbers on the webinars. Thank you very much. And also just to say to everybody that we will send out a digital copy of everything that has been covered in this webinar series in our Shift booklet. But if anybody would like an actual physical copy, I'll just show you one here now as well. So it's an actual booklet with all of the information inside it. You can drop us an email. So I'll have all of the details up at the end, and we will actually post those out to people as well, or drop them off to you. So you can have both. There'll be a digital copy sent to all of the emails that you use to register and log into this webinar series. But if you would like the booklet, you can just drop us an email with the names, the number of booklets you'd like, and an address to post them to, and we'll make sure that you get them. So we will kick off for today. So STIs, or sexually transmitted infections, what exactly are they? So a sexually transmitted infection is an infection that is passed on through sexual contact with someone who is infected. So somebody has to already have the infection, and they'll either have some form of sexual contact with a partner and they'll pass it on. That sexual contact can be anything from vaginal, anal, or oral sex. So all of those are risk activities to contract or transmit STIs. Some STIs can actually just be passed by skin-to-skin contact. So it doesn't always have to be a sexual act. It could be that if somebody has an outbreak of herpes, which we'll talk about in more detail in a minute, they might have kind of sores or lesions on their genital area. And by actually just rubbing that or putting it near somebody else's skin, they can transfer that to somebody else's genitals. So it's not always a sexual act. It could just be two people rubbing up against one another can cause the transmission of STIs. So it's really important that we know all about the different types of STIs, how they're transmitted, what symptoms you're looking out for, and how they're treated, so that if you're engaging in sexual activity with somebody else, that you know how to be safe, you know how to prevent those things, but also that you know how to get tested and how to manage something and what it might be if it comes up, because these are really common, as you'll see when we talk about it. It's an unfortunate part of sexual health. It comes with the territory of being sexually active. These things are out there. So we just need to be educated in how we go about managing and protecting ourselves against STIs. So when we think about why they're so easily transmitted and where these things are coming from, because I'm always asked those questions of like, but how? How did I get an STI? So if we look at the bottom here, we have a couple. So just a heterosexual couple for the sake of this diagram. We have a male and a female, and they are in a relationship and having sexual activity with one another. But she has had two partners maybe before, and then those two partners have had two partners, and so on and so on. And by sleeping with one person, you're actually potentially opening yourself up to any STIs and any infections that were present for any of those sexual partners, because they could be passed on. So if somebody here had an STI, they could pass it to here, to here, to here, and now she has it. So by sleeping with somebody, you're not just potentially opening yourself up to, well, that's only one person, it's a low risk. You're actually sleeping with everybody they have had sex with. And the only way to protect ourselves around that is that if they both go and get tested, they know their STI status and they're starting from a level playing field. So if they have an STI, they can treat it or they can manage it and tell their partner about it. But if they don't know what they're potentially transmitting. So we can see how easily they're spread, how common it is, how actually there's a huge trail. So our sexual history is actually our sexual risk that we carry with us. And we need to be open about that, open to testing, and open to being sure that we know what our STI status is. So what we're going to do is we're going to look at the different types of STIs that exist. So there's two categories, I suppose, is the easiest way to describe it. So there's two different types of infections. The first one is bacterial infections. And these types of infections are curable with antibiotics. So if you get a bacterial type of an STI, you take an antibiotic and it will be gone within 2 or 3 weeks. So they're easy to treat and get rid of, but they're the really common ones that people come across a lot, and often they have no symptoms. So it's one of the reasons it's really important that we get tested, because you might have one of these STIs if you're sexually active. But unless you go get tested, there's no way, if you don't have a symptom, to know whether you have it or not without a test. So we'll just look through what exactly are the bacterial infections that exist. Now, there's more than the ones I'm going to cover today, but I'm just going to look at the most common ones. So the first one we're going to look at is chlamydia. So chlamydia is a bacterial STI. It's quite common. Most people will have heard of chlamydia or know about it, and it's spread through sexual contact. So it can be passed orally, so it can be in somebody's mouth or in their throat, and if they're engaging in oral sex, they can pass it that way, and it can be spread through anal or vaginal sex as well. The symptoms then, if somebody thought or was wondering whether they might have chlamydia, is that for most people, they don't experience any symptoms. So more people than not won't have any symptoms of chlamydia. They won't necessarily know that they have it. For other people then, they might experience kind of pain or burning in their genital areas. There's often, for men, maybe a discharge from the tip of the penis, and painful urination for men and women as well. So you might get kind of a burning or a stinging when you're urinating. So most people don't experience those symptoms, but some people do. For the majority of people, they don't have any symptoms. And what chlamydia actually does is, if it's left untreated as a bacteria, it affects our fertility. So for women, it damages our fallopian tube. So when we spoke about menstruation, we talked about how the egg comes out and it sits in the fallopian tube waiting to be fertilized. But chlamydia basically scars the fallopian tube and it makes it close. So it's too tight for the egg to get through. And if the egg can't get through your tube, then it can't meet the sperm and you can't get pregnant. So over time, chlamydia is causing damage to that tube. And if it's left for years and years and years without treatment, somebody might find that they're infertile. So it's really important, if you're sexually active, you mightn't be thinking about having children now, and you mightn't have any symptoms, but you could be in your late 20s trying to have a baby. It's not happening, and you go to get tested, and it turned out you contracted chlamydia when you were 17 or 18 and never knew you had it, but the damage is done at that stage. So it's one of the really important ones, really common, that if you think or you're worried about it, get tested. It's treated with an antibiotic. So again, really easy to get rid of. You take your antibiotic, it'll be gone in about 2 weeks. And the easiest way to prevent chlamydia, and the majority of the STIs that we're going to talk about today, is condoms. So condoms are the best form of prevention against STIs, because you're stopping that sharing of fluids so people aren't sharing any STIs then. The other one that's very similar to chlamydia that people sometimes get confused around the two is gonorrhea. So again, like chlamydia, most people won't experience any symptoms with gonorrhea. Men and women might experience some burning or some discomfort in their genital areas. Men often describe having like a greeny discharge, so that's kind of unique to chlamydia. A little bit gross, I know, I'm sorry, but that's part of it. And again, painful urination or frequent urination as well is one of the things, so needing to go to the bathroom a lot. Just like chlamydia, it's treated with antibiotics. So all of these bacterial ones, you can take an antibiotic and it will go away within about 2 weeks. Prevention, if you don't want to contract chlamydia, again, using condoms if you don't know somebody's status or you haven't had a test is the best way to prevent ever contracting gonorrhea. So chlamydia and gonorrhea are very similar and exactly the same treatment. Antibiotics, cleared up, gone. And the only way to know for sure for most people, because there is no symptoms, is to get tested. The other bacterial infection we're going to look at that's quite common and is actually being seen a bit more is something called syphilis. So syphilis is kind of a historic one. So it's been around for years and it was quite serious historically in that there wasn't a treatment for it and people didn't know that they had it. So they went a bit mad, I suppose, by the time it got to the end of its lifespan. But syphilis, again, is a bacterial infection and it can be treated with antibiotics. So it's really important that we know about it since it's being seen more and more now. The symptoms of syphilis are different to the others in that it presents in different ways. So there's 3 different stages to syphilis. Again, like the other ones, it's skin-to-skin contact is how it's transmitted. So coming into contact with somebody else's skin, generally in the genital area. Anal sex, oral sex, vaginal sex are all risks for syphilis as well. The first thing that people usually notice is on here, so stage 1, 3 to 90 days after their risk experience, they might get a sore. So not everybody gets this. It's painless. It usually goes away a couple of days later again, so people don't actually take that much notice of it, unfortunately, often. And after that, maybe 4 to 10 weeks later, people might get a rash. So it can be a full body rash. Some people have described just getting it on the palms of their hands. And that's the second stage of syphilis. So it's almost like this is the second chance if there's something going on here, there might be something wrong. But a lot of people actually put this off to being other things because we don't think of a full body rash as necessarily being an STI because it's not, you know, located around the genital area maybe. And it's often put down to maybe I changed my fabric softener or maybe, you know, there was something I was allergic to. So I just had a bit of an allergic reaction. And again, without treatment, this will go away again itself after a couple of days. So people usually brush it off and think that it's gone. And in the meantime, if somebody hasn't been tested for syphilis, the actual bacteria is still in the body and it starts to attack the internal organs. So 3 to 15 years later, so it's different for everybody, there's a whole time frame. What syphilis is doing in the body is it attacks your nervous system. So it starts to attack the brain, the heart, the lungs sometimes, and it's starting to damage the inside of somebody's body. Like the other ones that we spoke about, treatment is an antibiotic. So even if somebody was in the 3rd stage, they might have had syphilis for 10 years. If it's caught, and it's a blood test usually to test for syphilis, they'll be given antibiotics and it can be cured. But if they've gotten to the point where syphilis has done maybe some damage to their brain, it can affect the eyes as well. They can kill the disease and stop it where it is, but they can't undo any of the damage that might have been done. So it's another reason, again, that it's really important to get tested because some of these can be quite dormant or not symptomatic in our systems. So we think we're fine, but we could have been exposed to them. Again, the best way to prevent any of these bacterial infections is condoms. So condoms prevent any of the sharing of fluids. So they prevent people from actually contracting or transmitting an STI if they have it. We're going to look then at the other type. So we have bacterial ones that we know can be treated with an antibiotic. The other type of STIs then are viral infections. So viral infections aren't easily cured, and for the majority of them, there is no treatment. So These types of infections aren't curable, but there are some treatments to lessen the symptoms. But if you contract one of these STIs, it means you'll have it for the rest of your life. So if somebody contracts one of the ones we're going to look at in a second, it'll be something that will be with them for the rest of their life, and they'll have to manage on an ongoing basis. And they are in a position usually that they have to disclose it to sexual partners. So if they're starting a new relationship or they meet somebody, they have that virus in their system, so they have to tell a partner that they might be at risk or that this is something that comes up for them. So the first one we're going to look at is genital herpes. And genital herpes is basically like the cold sore virus that most people suffer from. Like, it's a huge percentage of the population, really common. People get cold sores on their mouth and on their lips. It's spread quite easily. So if you come in contact with somebody who has a cold sore, they can transmit it to you through kissing. And it's the same with genital herpes. If somebody has genital herpes, they can transmit it to a partner by pressing their genital area against them. So that herpes virus, if they have an outbreak, can transfer across. So the other way then that it can happen, so we have sexual contact, so transmission. So if somebody has an outbreak on their genitals, they can transmit it that way. But if somebody actually has a cold sore and they engage in oral sex with a partner, that cold sore, obviously you're putting your lips towards somebody's genitals with the herpes virus, you can transmit it that way. So it's really important for somebody, if they have a cold sore, that they don't engage in oral sex with a partner. And equally, if they have a cold sore or they have genital herpes, that they're really careful with hand hygiene. So don't touch your cold sore and touch somebody's genitals, or if you have any outbreak on your genitals, not to touch it and then touch somebody else, because it can be spread that way as well. The symptoms of genital herpes then is actually having those kind of outbreaks. So they're little blisters and sores. This is just a cartoon version of it on the right. They're little blisters and sores that people get around their genital area. They're really quite uncomfortable, and some people, will have to get medications to lessen the pain. As it progresses, people, will get lesser outbreaks. So a bit like a cold sore, the first outbreak is often the worst. So the first outbreak might be much bigger, much more painful, much angrier of an outbreak. And as time goes on, the outbreaks will lessen in kind of seriousness and also in frequency. So somebody might get an outbreak of genital herpes every couple of months to begin with, and then it might become every few years as time goes on. The same as with cold sores, they usually flare up when somebody is tired or run down because their immune system isn't at its best, so the virus tends to pop up. The treatment for genital herpes is antiviral medications where necessary. So what those are medications that just try to help fight the virus a little bit and bring it down so it's not as serious, but they can't cure it and they can't get rid of it. So the best way then to prevent genital herpes, again, is condoms. Or if you are in a relationship with somebody who has genital herpes, avoid having sex while they're having an outbreak is really important, just so there isn't any chance of transmission. So for somebody who might contract genital herpes, it can be quite a scary thing because it's something they have to tell future sexual partners, perhaps, because it's something they're going to suffer from throughout the relationship. And it's also something then that they have to manage and be careful about. So if they think they might be about to have an outbreak or they are having an outbreak, that they don't engage in any sexual contact with somebody because it can be transmitted then that way. The other viral infection then that we're going to look at is the HPV virus, or this is commonly referred to genital warts. So genital warts are similar to the herpes virus in that if you contract genital warts, they're something that you will have on an ongoing basis for the rest of your life. The transmission of genital warts is skin to skin contact. Again, usually the genital area, so somebody pressing their genital area against somebody else's, and that skin presses against somebody else's skin, so the virus is transmitted that way. The symptoms of genital warts then, for a lot of people initially, they won't have any symptoms. So there can be almost a couple of years, in fact, for some people between coming in contact with genital warts and maybe even having an outbreak. Not everybody will have any symptoms at all. So some people will carry the HPV virus, but they won't ever have an outbreak of genital warts. Some people will, they'll experience genital itching, and they'll also get genital lumps or bumps. And they're just little raised lumps or bumps like this, smaller than the warts that people might, you know, some people get them on their fingers sometimes. So they're smaller than that, but they'll appear around somebody's genital area, around their anus. And there is treatments available if they're sore or uncomfortable. So they can sometimes go away on their own. But if they don't, or if they're in an awkward place, like somebody might get a genital wart on the tip of their penis or somewhere uncomfortable on their vagina, and they can be cryogenically removed. So that's like cryo freezing. So they actually freeze off the wart, and there are creams or the potential for surgery to actually have them surgically removed. So there are options, but mostly people wait for them to go away on their own. But it's again something that they have to manage on an ongoing basis. The prevention for HPV or genital warts again is condoms. So with all of these that we've talked through so far, the common denominator is creating a barrier between you and somebody else so that you're not sharing genital, I suppose, fluids, and doing your best to make sure that there isn't anything going down below for somebody. So we'll often say to people as well, don't be afraid to have a look. So as humans, as people, sometimes we're not the best at actually looking at ourselves or looking at our genitals, but actually taking that time, like we said before, to get to know your own body, maybe take a mirror and look at yourself sometimes can always be a good way as well if you're sexually active in a relationship to keep an eye on your body and make sure that you notice if there are any changes or if there's anything going on down below that maybe wasn't there before, that you might pick up on some of these lumps or bumps. Or if you see them on a partner, not to be afraid to mention it because maybe they didn't notice, and advise them to go get tested and use condoms or protection or abstain from having sex till you have an answer to that question. The HPV vaccine as well then is something that is available. So in Ireland, every girl in secondary school, usually first year, gets offered the HPV vaccine for free. So it's something that we put out in schools, and that prevents or offers protection against the HPV virus that causes genital warts, but it also prevents against other HPV strains which have connections to cervical cancer and other things like that. If people are interested in HPV vaccines, if they haven't gotten them, you can contact your GP or you can look them up online. And for some groups like MSM, who are men who have sex with men, they can be available at STI clinics. So if you go for a test, you can talk to them about the HPV vaccines while you're there as well. So these are just a couple of little things just to recap. So they are the main different types of STIs that are out there. So we have our bacterial ones like chlamydia, gonorrhea, and syphilis, and we have our viral ones like genital herpes and genital warts. Can you get an STI from oral sex? So yes, absolutely you can. So things like chlamydia, gonorrhea, syphilis, herpes around your mouth, and HPV can all be transmitted orally. So if you are engaging in oral sex, it's really important, if you don't know somebody's status, to think about using a flavored condom, and again, creating that barrier just to be sure that none of these are being transmitted and you're engaging in safe sex. Oral sex, just in case anybody doesn't know, is the use of the mouth, lips, tongue to stimulate the clitoris, penis, or anus. So using any of your mouth or tongue on any of those areas is a risk for the transmission of STIs. And the other one then is, can you have an STI and not know it? So just to recap this for people, yes, you absolutely can. So things like chlamydia, gonorrhea, syphilis, for the most part, if you missed maybe the sore or the body rash, could be present in your system and you might have no clue that they're there. They don't have any symptoms for a lot of people, so you could have an STI and not know it. And the only way to know for sure that you do or don't have an STI is to get medical advice and get tested regularly. So if you're starting a new relationship with somebody, it's a really good idea to go and get tested, because that way you're starting out knowing your STI status and you can choose whether you decide to use condoms or not. But for the most part, they're advised because it just prevents against the spread of any STIs. The next one we're going to look at then is HIV. So HIV isn't usually, I suppose we separate it out a bit because it's not quite the same in terms of it being an STI and being treated. HIV is more serious in some ways, but there's a lot more to it nowadays. So it's really important that we talk about it. So HIV is a human immunodeficiency virus, and what that means is the HIV virus attacks our immune system. So it attacks our ability to fight off everyday infections. So if, for example, I contracted HIV, it would reduce my ability to fend off a cold, or maybe I'd be more susceptible to the coronavirus if I got it. There isn't any cure for HIV at the minute, but there are really effective antiretroviral drugs available. And what they do is they reduce the amount of the virus in my system. And they're so effective that they actually reduce it to a level that if you tested me again for HIV, if I was on these medications, it would show them as being undetectable. So no HIV would show up in my system. And there's a whole campaign, I don't know if anybody's seen it around, of this U equals U, and it's to spread that message. So if somebody is on effective HIV medication and it reduces the virus in their system to undetectable levels, it means that they cannot transmit HIV to their sexual partners. So if somebody has an undetectable HIV load and they have unprotected sex with a partner, they cannot give that person HIV because it's so little in their system that it's basically non-existent. So that's how far we've come with HIV. It's incredible, really, but there's still a huge amount of fear and stigma around HIV. So it's really important that we talk about it and educate people around HIV so that they know exactly how it's transmitted, what it does, and how it's treated nowadays, and what we can do to prevent it. So if you see the U equals U message, it means undetectable equals untransmittable. And just to highlight for people as well, it's very uncommon nowadays, but just in case you do need to know, a lot of people are confused between AIDS and HIV sometimes, and they don't understand the difference between them. And AIDS was quite a common term a while ago, so it's often something that people remember. So what AIDS is if somebody was diagnosed with HIV and it was left, or they weren't, so if somebody had HIV and it was left untreated, it would become the AIDS virus. So it would get to a level where their immune system had so many infections that they couldn't fight off that it becomes, I suppose, a death sentence in a way, that they're probably going to die from AIDS. So they don't die from HIV, they die from the other illnesses because their immune system can't fight them off. So AIDS is something that can't be transmitted from one person to another, but the HIV virus is. It's very unusual for anybody in Ireland to be diagnosed with AIDS nowadays because of the treatment and everything being so successful around it. But just so that you know, if somebody was ever not aware they had HIV and it was left untreated, it could become AIDS. So how is HIV transmitted? So HIV actually isn't passed on that easily from one person to another. So the virus doesn't spread in the air like the coronavirus that we have in the minute. And it's not like flu viruses that if somebody sneezed on you or you shared a cup or a spoon that they hadn't washed. HIV lives in the blood and in some bodily fluids. So it's really specific in how it can be transmitted. You cannot get it off sharing cups, cutlery, towels with anybody. It's only particular acts that will spread HIV. So in order for HIV to transmit it, it has to be from the body of a HIV positive person into the body of another person. So it doesn't just miraculously appear, it has to come from one person and then go to another. And so HIV is found in the blood, it's found in semen, it's found in the vaginal fluid, breast milk, and rectal secretions. So that's the only places that HIV would be present if somebody had it. And therefore, it's transmitted through unprotected sex. So if somebody is not using a condom and they're having sex, vaginal, anal, or oral, again, it's in the vaginal fluid. It could be in the semen, so that they would be the fluids that would be transmitting it. Blood-to-blood contact then, so using contaminated needles, maybe for IV drug users, or blood transfusions in some countries where the blood isn't screened. So blood-to-blood contact, and it would have to be a decent enough amount of blood. Mother to baby then as well. So during pregnancy, obviously childbirth or breastfeeding, there would be a risk of HIV. But if we know that a mother is HIV positive, there's medications that she can take. So a HIV positive mother can have a HIV negative baby. So just because a mother is HIV positive doesn't mean that a baby will be, but during the actual childbirth, there would be a risk. So they'll often do a cesarean section rather than a natural birth, just to make sure that there's no transmission. So some of the frequently asked questions then around this would be, how long does it take to develop signs of HIV? So people with HIV can have signs of infection anywhere from months to years after being infected. So there isn't a standard time frame. It can differ for different people. So it's just something to keep in mind. If somebody thinks that they might have had a risk of HIV and they're not sure, it's really important to go get tested, because people can have HIV in their system from months to years after being infected without necessarily showing signs. So what are the symptoms though if somebody was looking for it? So some people will get flu-like illnesses, so that kind of cold, cough, tiredness, if they become first infected with HIV. But a lot of people are often unaware that they're infected because they might not feel sick right away or for many years after being infected. If someone has been at risk for HIV, it's important to get tested, because the only way to know if somebody has it is to actually get a test. For those who are at higher risk for HIV, so men who have sex with men and people who ingest drugs, it's important to get tested for HIV if they've been at risk. So for certain populations, HIV is slightly more risky than others, so they would have a higher rate or kind of promotion around getting tested and being sure that they don't have HIV. So inside in the Sexual Health Centre, we offer rapid HIV testing for MSM. So people can come in and they get a pinprick test on their finger and they'll get the result within a minute. And if they are positive for HIV, we have a HIV support worker who will work with them, and they'll be referred to the HIV services then in the hospitals in Cork and be supported around getting on the medication and getting the HIV under control and down to those undetectable levels. So around HIV then, there are some new advancements that's been made along with the antiretrovirals for people who have HIV, who will take that every day and it keeps their levels down. There are two other medications that have come onto the market that it's really important that people know about, and these are PrEP and PEP. So what they are basically is they are prevention tools to stop people contracting HIV if they are at risk of it. And so PrEP stands for pre-exposure prophylaxis. So what that means is PrEP is a medication that somebody would take before they're engaging in a risk activity so that they cannot develop HIV when they do. And what PrEP does is it's a pill that someone takes every day. It takes about a month, a bit like the contraceptive pill, to build up in their system, and that then will prevent the HIV virus from being able to replicate in their body. PrEP is for vulnerable people for HIV infection, so that could be things like sex workers, IV drug users, or people who are regularly engaging in high-risk sexual activities for HIV. So it's not for everybody. It doesn't protect against any other STIs. It's only for HIV, and it's only for certain groups who are at high risk of potentially coming in contact with HIV, that they want to take this on a regular basis to prevent them contracting it. The other version then that's available is something called PEP, and what PEP stands for is post-exposure prophylaxis. And PEP, again, is another type of medication that somebody can take up to 72 hours after a possible HIV exposure. So if somebody thinks they've been exposed to HIV, so they might have had unprotected sex with somebody and found out that that person was high risk for HIV, you can go to an emergency department within 72 hours of that and ask to access PEP. And what PEP is it's a medication that somebody takes for a single event like that, so it's not on an ongoing basis, and they'll take it for about a month after the risk activity. And again, it stops the HIV virus from being able to replicate in their body. So if you've had an exposure, it's something that somebody can take to stop them being able to contract HIV as a result. So they're huge steps that we've taken, that we have the ability to have something that used to be so serious like HIV. We have people now on such effective medication that they're basically undetectable and can have normal active sex lives without putting anybody at risk. And if somebody thinks that they're at risk in terms of how they go about having sex, that they can take a medication to prevent them contracting HIV, or if anybody ever discovers that they've had an activity where they might have been at risk, there is a drug they can take afterwards to stop them getting it within 72 hours. So it has to be taken within 72 hours, which is 3 days. So just keep that in mind. So it's just really important to know that those things are out there, and there's such positivity around something like HIV, which a lot of people would have found quite scary and terrifying. So with all of our newly acquired knowledge around STIs and HIV, I think it's important that we look at the rates of STIs in young people. So in the people who are on this webinar today, it's nice to know what's kind of happening for your own age group and why is this important that you know. So chlamydia makes up 49% of cases reported. So almost half of the STIs reported in young people in 2019 were chlamydia. Gonorrhea made up 32%, and genital herpes made up 39%. So the top 3 STIs are chlamydia, gonorrhea, and genital herpes. And the reason that I've used 2019 here is because 2020 was the pandemic. So obviously the first 3 months of the year, kind of services were operating as normal, but for the rest of the year, things were a little bit off. So it was just easier to take a year where everything ran pretty straightforward. But it just gives you an idea of the general rates and what's coming up for young people. So if we look at it just in a little bit more detail, so 2019 yearly figures showed us that for 15 to 19-year-olds, the total number of cases in the year that were diagnosed of STIs was 675 cases. So in all of Ireland, in the year of 2019, 675 cases were diagnosed in 15 to 19-year-olds. The highest number of cases was for chlamydia. So it's the most, I suppose, not popular, but it's the highest kind of STI that exists within that age group. And that's the case across the board usually. So as we spoke about, chlamydia bacterial, it's easily treated with an antibiotic, but it doesn't generally have symptoms. So people don't know that it's there. So they mightn't actually get tested. So it's really important that we do, when we see that the people who are coming forward for testing, there's such a high figure there for chlamydia. We also have 71 cases of genital herpes. So like we spoke about, that's something that somebody is going to have to manage for the rest of their life. They will continue to get outbreaks and they'll have to disclose to sexual partners and they'll have to manage it. And we see as well 2 cases of HIV. So again, we know all of the information now around HIV, but there's 2 people in 2019 within 15 to 19 years who were diagnosed with that who will be managing it. If we look then to the 20 to 24-year-old bracket, we can see the numbers double, even over double for a lot of the cases. So it really shows us that the 20 to 24-year-old bracket, people are taking maybe a lot more risks. Maybe people aren't using condoms. Maybe they weren't getting the education around how to prevent the transmission of STIs. And it's great to see that these are being caught and that these people are coming forward for testing. But we're also aware that there's a huge amount of people who aren't getting tested, who aren't experiencing symptoms, maybe aren't coming forward. So it's just important to look at that. Now, I know I said I used 2019 a second ago because it was a more maybe accurate representation, because people were able to access services as normal. You know, maybe a lot of people were able to be in towns and away from home, so it was easier to go in more subtly for an STI screening. But what do people think 2020's yearly figure was like? I'd just be curious in the chat box. Do you think the kind of numbers went up, or do you think they went down because people were at home more with the pandemic and maybe couldn't access services, or maybe weren't engaging in sexual contact because they weren't meant to be having sex during the pandemic? Just have a look. Down? Yeah. Anyone else think they went down or up? Down, pubs closed, clubs closed. Yeah, interesting. Yeah, I would have been on the same boat as all of you, so I would have thought they went down. And then I was putting this together and I noticed this. So in 2020, the total figure for the year for 15 to 19-year-olds was 977 cases. And if we look at that, chlamydia, there was 704. So the year before there was 464. And in 2020, we had 704 cases. For something like herpes, there was 104 cases, whereas the year before there was 71. And I think that that's quite interesting, because we do know that services were reduced. We know that people were at home. We know that it was harder for people to access services, and yet the figures went up. And again, these are the people coming forward for testing. And maybe some of this is a result of people not being able to access contraception. So people maybe took more risks because they couldn't access condoms as easily, and they just thought maybe it's going to be fine, I'll just do it. So we can also see again the numbers jump up when we get to the 20 to 24-year-old group. So we have almost 3,000 cases of chlamydia in that age group. So it's just something to keep in mind. And I think it's really interesting to see that these STIs are out there. They are affecting these age groups. So 15 to 24-year-olds, the numbers are there to prove that it is happening. And if you are sexually active, or you're going to be sexually active with somebody who has already been, that they get tested and that you know your status, you can deal with whatever it is. You can take your antibiotics, or you know you have support and you can manage any condition if you do have it. But it's the not knowing means that these numbers continue to go up because people aren't getting treatment and then they pass it on to somebody else. If we look then at STI testing, so people are getting tested, and that's great to see because we have those numbers. But sometimes I think people are nervous about STI testing because they don't know what's going to happen if they go to get a test, or who's going to be there, or what it's like. So I'm just put together a couple of the kind of frequently asked questions around STI testing so we can look at what do people need to know about it. So who should go for an STI test? Anyone who's ever had unprotected sex or sexual contact should get a test. So if you've had an unprotected sexual contact with somebody, you are at risk for an STI. The majority of STIs have no symptoms, like we talked about, so the only way to know for sure is to get it checked. When it comes to going for an STI screening, sometimes people aren't sure if they have the right to do it, or do they have to tell a parent or guardian. So I've just put this in around medical consent. So any young person aged 16 years or over can access any medical service like an STI screening independently. So you have the right to access that. And it's not an offence for anyone under the age of 17 to purchase condoms or other contraceptives. So if somebody thinks that they're sexually active, or they're going to be, and they need to access contraceptives, they should go forward and do that. So with the likes of the YHS, and be sure that they're protecting themselves against pregnancy. And condoms, like we spoke about, are the best method to prevent against all of these STIs. So if you need to access condoms, you can do so at any of the sexual health hubs that we have out across the city, or you can contact us at the Sexual Health Centre, and we'll try to help you out with those as well. So just know that you have the right to attend for an STI screening if you're 16 years or older, and also that you have the right to access contraception. So if you are going to be sexually active, just be safe. Then the other thing around STI testing is, where can you actually go to get a test? So if you are in Cork City or County, you can go to the GUM Clinic, which is in the Victoria Hospital. So it's by Paddy the Farmers and near Anglesey Street. And if you're not sure where that is, you can look up the whole list of STI clinics for the nation on sexualwellbeing.ie. So they'll give you the whole list of services and the contact details around those. You can go to your GP, who can perform some tests, but you might still be referred to the STI clinic just for specialist treatment if you did come up positive for one of the STIs. And the Youth Health Service then offers a free STI clinic for anybody 23 or under, and they also have a free contraceptive clinic. So they're a fantastic service that we have in Cork City. I have the details up here below, but you can Google them, the YHS or Youth Health Service. And if you are looking to access contraception, or you want to access an STI screening, they're free and they're available for anybody under 23, so you can book in with them. The other things I often get asked is, well, my partner had a checkup and was given the all clear, so like I'm with him, so that must mean I'm okay, or I'm with her and she didn't have anything, so then I mustn't have anything. And it's really important that we always mention that that's not necessarily the case. So you might have an infection that you hadn't yet passed on to your partner when they had their checkup. So we know for things like genital herpes, for example, they're only infectious when somebody's having an outbreak. So if somebody wasn't having an outbreak or didn't know that they had it when they got tested, they mightn't show up that they have it, but they could still be at risk of transmitting it. So ideally, a couple should get checked at the same time to avoid any confusion. So if you're starting a relationship, you can book in to the STI clinic and go get a test. And that way you're both starting out with your results and you know where you're at. How much does it cost? So that one always comes up for people as well. So at the GUM Clinic, which is in the Victoria Hospital or the YHS, it's free. and any treatment. So if somebody needs antibiotics afterwards, that's also free. There may be a charge at your GP. So some GPs will charge their standard fee for people. So that's why we'd always recommend going to the gum clinic or the YHS first. And what if I meet someone I know in the waiting room? I've gotten this one a couple of times as well. So people are often embarrassed about actually going to the clinic or being seen going to the clinic or going in. And I think it's important that, it's not very often that people will actually meet somebody that they know. But if you do, or somebody sees you going to the STI clinic, it doesn't mean that you have an STI, and it doesn't need to be something that's awkward, because if you think about it, you're taking care of your sexual health, and so is anybody else who's going there. So if you meet anybody in the waiting room that you know, you're both there for the same reason, and it's a good reason, that you want to be safe, you want to take care of your sexual health, and there's nothing to be embarrassed about around that. And it's better that you go and get tested than the person who's outside that you feel is judging you, who's not going and doesn't know their status. So don't ever be embarrassed about going to get an STI test, because it's really normal, it's really natural. We wouldn't be embarrassed going to the dentist to get our teeth cleaned every year. So why are we embarrassed about taking care of our sexual health? We don't need to be, and we just need to normalize that this is a thing we all do. If people are sexually active, you make sure that you're okay by getting an STI test. If you have a pain in your tooth, you go to the dentist and you get it checked, because we need our teeth to eat. They're things that we do all of the time, so we shouldn't have any judgment or embarrassment around them. And the other one I often hear is, how often should I get a checkup? So this really depends on the individual, so it will be different for everybody, but it's all about the risks that you've taken and who you may have been with since your last checkup. So if somebody has been with a partner continuously for 5 years and nobody is straight outside the relationship, and you both got tested at the beginning of that relationship, you probably don't need to get another test. But if somebody is having sex with multiple partners, or has been taking risks, or may have to start a new relationship, it's best to get tested. That way you both know where you're starting out from and what your status is, and you can go forward knowing that and make all of your decisions together. So they would be the kind of advice we would give around that. It's individual to every person how often you need a checkup, but if you are sexually active or you've had unprotected sex in the past, it's important that you just get a checkup so you know what your STI status is. So this is the last piece of our webinar today. So I'm just going to play everyone a little video, which is from Spun Out, and it's basically a run through of exactly what would happen if you go to an STI clinic, start to finish. And we'll just take a look at that, because I think it'll answer most of the questions and take some of that kind of stigma or fear around, I don't know what it's going to be like when I go in there.
So today we're here in St. James's STI Clinic. Ellie and I are going to get tested just to show how easy it is.
Anyone who's sexually active is at risk of contracting an STI, so should be tested. It costs nothing and everything is completely confidential, so you don't need to worry. All you have to do is show up the day the clinic is running.
When you arrive, you'll get a ticket and they'll call your number when they're ready. Then you'll have to fill out a form to register with the clinic, and don't forget, if you're a guy, hold off and go into the toilet for an hour beforehand.
Before we get tested, we're going to talk to Gráinne about some common STI myths.
So firstly, if I had an STI, surely I'd know about it.
Not necessarily. Not all sexually transmitted infections actually have symptoms, so you wouldn't necessarily have any physical signs.
And what if I'm on the contraceptive pill?
The contraceptive pill just protects you from pregnancy. You need to use condoms if you want to protect against sexually transmitted infections.
If I had an STI, I'm worried that would prevent people from wanting to have sex with me.
Well, the most important thing is that you have a test, and then you know if you have a sexually transmitted infection, then you can get treatment for it. If you are open with new partners, good to have the conversation about testing, and then you can both get tested and start from a level playing field.
What if I've only had oral sex?
So there's still a risk of sexually transmitted infection even if you've just had oral sex. Because there's a lack of penetration doesn't mean that you're immune from STIs.
Okay, so will we get started?
Yeah, great.
So how exactly is this going to go?
So first of all, I'm going to ask you a few questions about your sexual history to make sure I'm doing the right test for you. And then I'm going to take a blood test. And then I'll explain to you how to take your swab test.
And is it going to hurt at all?
I'll explain it to you and you'll take your time doing it nice and slowly, and it shouldn't hurt. The blood tests just feel a little pinch, but there's just one sample, so it's over very quickly.
So, as a guy, how exactly is the test going to go?
So first of all, I'll just ask you a few questions about your sexual history to make sure that I'm doing the right tests for you. And depending on your answers, I will do a test for a heterosexual man for a blood test and a urine sample. For men who have sex with men, we take a urine sample, a blood test. I would take a swab from your throat, and I'd explain to you how to do a rectal swab yourself.
And what STIs exactly are you testing for?
We're testing for chlamydia and gonorrhea from the 3 sites, from the throat, from the urine sample, and from the rectal swab. And the blood tests are checking for HIV, syphilis, hepatitis B, and hepatitis C. So are you ready to get started?
Yeah, let's do it.
So that's everything.
Okay, great. And what happens next?
There's 2 options in terms of getting your results. The first is that we would call you if there's any problems with any of your results. If you don't hear from us after 2 weeks, everything is okay. The other option is that we can make an appointment for you to come back and get the results in person if you'd prefer to do that.
Okay, brilliant, thanks. So we're done here at St. James's Guide Clinic for today.
Now we just have to wait until we get our test results back.
So we're back here at Spunard HQ. It's been 2 weeks since we got our tests done and we haven't heard anything from the clinic, so we're safe in the knowledge that we're infection-free.
As you can see, getting an STI screening is super easy. Getting bloods taken is nothing more than a pinch, and there are loads of free clinics around the country. You can click here to find your own local clinic.
Some clinics even have a service to contact your former partners in case you don't feel comfortable in doing so yourself. Most STIs are totally curable and all of them are treatable and manageable with the right treatment. So guys, if you do have an infection, it's not the end of the world.
So that I think is just a really useful video because it just shows you exactly what would happen if you go to an STI screening. It is super easy, exactly like they showed. You'll get the results within 2 weeks. And like they said, if there is anything that shows up, it's often treatable with antibiotics. And if not, there's support and answers around how to manage and treat something going forward. So there's nothing ever to be embarrassed about STI screenings. STIs are a part of our sexual health. They are something that are out there. They are very common, unfortunately, and it's something that most people need to know about so that they can manage and prevent things going forward. So I hope that answered everybody's questions and gave you a great overview of STIs and how to understand them and know what you're looking for if you ever are worried that you might have been in contact with one. And if anybody has any questions, you can throw them into the chat box now, or you can unmute yourself and I'm happy to answer them. And I'll just recap for everybody as well that if anybody would like a physical copy of the shift booklet, which is everything that we spoke about in this webinar series, if you want to email me at education@sexualhealthcentre.com with the amount of booklets that you'd like and where to post them to, I'm very happy to send those out to people as well. And anybody who doesn't, we'll just send a digital copy to the email address that you registered for this webinar. Thanks so much, everyone.